So my question is, what happens when you've built up a rapport and they believe in you and trust in you and you think you've done everything right and you've convinced them to go with your idea or your investigation, and you do all that and they've spent a certain amount of money, but actually you're still none the wiser as to what is actually going on, or you can't give them a definite answer, or there's no definite, cure, or it's not like a procedure where they then see a massive improvement and you go home on meds and a big bill and actually, you feel bad because actually you don't know what's going on.
Okay, that is a brilliant question, and I know that lots of people struggle with this one. Really, it's about how I feel bad because I've spent some money and all the results have come back normal. Now, this is just a mental positioning that you have to get into your head, that sometimes you're going to test for things and you're not going to get the definitive answer. But that doesn't mean you got no answer. It doesn't mean the money was wasted. What you've actually done is you've ruled out an absolute bucket load of things that might have been pretty serious things. Now, that means that the big things that are higher up your list are probably ruled out. Okay, so you can chalk out 4 or 5 things off your differential list. You know that you're dealing with something that's a little trickier to deal with, and those things are always a bit harder. Let's take an example. The dog that comes in with more chronic vomiting, and you do some bloods on it. Maybe you've come in and you've done a stomach biopsy on it under anesthetic, and it's come back as non-specific inflammatory changes, and there's a bill of £500. And now you feel a bit bad because you've spent £500 and you don't have a definitive answer. Well, that's okay, because you've ruled out liver disease, you've ruled out pancreatitis, you've ruled out kidney disease, you've ruled out, because you've had an endoscope down there, potentially tumours, and you've probably got some sort of inflammatory bowel disease here. So you've got a presumptive bucket diagnosis. Now you can target some treatment. Is it going to work? Don't know. But you've still done a good, thorough job, and you've still ruled out a ton of things. You should never feel bad about doing that, because you've worked logically, you've worked sequentially. The important thing in the way that you don't have an upset client is you manage that expectation at the start, and you say, listen, these cases can be tricky. Sometimes we're going to get answers. Sometimes it's going to be one of these challenging diagnoses where we don't know exactly what's going on, but we can probably target some treatment that's going to manage things along just great. But we need to do the tests because there are some things that are very specific and could be a big problem here. So let's do those tests, see what answers we get, and we'll see how we move along. But just be aware this might be the start of an investigation, and there may be other steps to come. And give them the price. So you've shown them what you're going to do now. You've shown them there might be a road beyond that. And if you do that, their expectation level is going to be managed. If you do get a definitive diagnosis on your bloods, well done you. You're going to have at least a client. They might not be happy at what you diagnose, but they're going to be happy that the money was well spent. And if you don't get a definitive result, or you get a series of normal results, you can celebrate normal. And that matters. That's a cool thing to do as well. Now, if you would like your question answered, then the way to go about doing that is to record your own little video clip that you don't mind us using, because we will make you famous as well. But send in your video question, or you can send in on Instagram or Twitter or email it or DM it, whatever. Send your question in. It's got to be about veterinary business, veterinary life, your career, what's going on with you. But ask a question that you think I can add some value back for you, and I would love to give you an answer on this show. And if you do send it in and we use your question, you'll receive a signed copy of So You're a Vet, Now What? And my eternal gratitude and some notoriety by being on the show. So don't be shy, step up and send in your questions. Thanks for listening or watching. Be safe, be well, be happy. Dr. Dave, out.